Today we're diving into an important topic that everyone should be informed about: sexually transmitted infections, or STIs. We're going to cover everything you need to know, from the different types of STIs to prevention and treatment options. Knowledge is power, and understanding STIs is crucial for protecting your health and the health of your partners. Let's get started with the crucial information you need to know. STIs are incredibly common, and they're caused by different types of infections. First, we have bacterial STIs like chlamydia, gonorrhea, and syphilis. The good news is these can often be cured with antibiotics if caught early. Then there are viral STIs such as HIV, herpes, and HPV. While these can't be cured, they can be managed with medications to alleviate symptoms and prevent transmission. Lastly, we have parasitic STIs like trichomoniasis, which are also treatable. Knowing the difference between these types of STIs is super important for understanding treatment options and long-term implications. Remember, even if you feel fine, you can still have an STI. Many people don't experience any symptoms, especially in the early stages, so getting tested regularly is key, especially if you're sexually active. One of the trickiest things about STIs is that they can be sneaky. Many times you might not even know you have one. That's why getting tested regularly is so important. But it's still crucial to be aware of potential signs and symptoms. Keep an eye out for any unusual sores, bumps, or rashes in your genital area. Pain or burning during urination is another red flag. Ladies, pay attention to any unusual discharge or bleeding. And for both men and women, abdominal pain can also be a sign of an STI. Remember, these symptoms can also be caused by other conditions. So, the best course of action is to see a healthcare professional if you experience any of these symptoms. Early detection and treatment are key. Let's talk about how STIs are transmitted. The most common way is through sexual contact, including vaginal, anal, and oral sex. But STIs can also spread through skin-to-skin contact, especially if there are sores or cuts present. It's important to remember that anyone who's sexually active can get an STI. Another way STIs can be transmitted is from a mother to her baby during childbirth. This is why prenatal care and testing are so important. The good news is that many of these transmissions can be prevented with proper treatment and care. The best way to deal with STIs is to avoid getting one in the first place. And the #1 tool in your prevention arsenal is condoms. Using condoms consistently and correctly every time you have sex is super important. Condoms create a barrier that helps prevent the exchange of bodily fluids, which is how most STIs are spread. But condoms aren't foolproof, so it's wise to combine condom use with other prevention strategies for maximum protection. Another powerful tool in the fight against STIs is vaccination. We have safe and effective vaccines available for HPV and hepatitis B. These vaccines work by helping your body build immunity and protect you from these viruses. Talk to your doctor about getting vaccinated. It's one of the best gifts you can give your health. We've talked about the importance of getting tested, but let's dive into what that actually involves. Getting tested for STIs is quick, easy, and often painless. Your doctor will usually take a blood sample, urine sample, or a swab from the affected area. These samples are then analyzed in a lab to check for the presence of infections. The frequency of testing depends on your individual risk factors and sexual activity, but in general, it's a good idea to get tested at least once a year if you're sexually active. And remember, early detection is key. It allows for timely treatment and helps prevent the spread of infection. The good news is that if you do test positive for an STI, most are treatable. Treatment varies depending on the type of infection you have. For bacterial STIs like chlamydia, gonorrhea, and syphilis, the go-to treatment is antibiotics. These medications work by killing the bacteria causing the infection. For viral STIs like HIV, herpes, and HPV, we don't have cures yet, but we do have effective ways to manage them. Antiviral medications can help reduce the frequency and severity of outbreaks, lower the risk of transmission, and slow down the progression of the virus. Ignoring an STI won't make it go away. In fact, it can lead to some pretty serious health problems down the road. Untreated STIs can increase your risk of developing other infections, including pelvic inflammatory disease or PID in women, which can lead to infertility. Some STIs can also cause long-term damage to your organs, including your heart, brain, and nervous system. And here's a scary thought. Having an untreated STI can increase your risk of contracting HIV if you're exposed to the virus. That's why early detection and treatment are so important. Talking about STIs might not be the sexiest conversation, but trust me, it's one of the most important ones you can have with your partner. Open and honest communication is key when it comes to sexual health. Before becoming intimate, have a conversation about your sexual history, any past STIs, and your comfort levels with getting tested. Remember, it's a two-way street. Listen to your partner's concerns and be open to answering their questions honestly and without judgment. Just like you schedule regular dental and physical checkups, it's important to make STI screenings a part of your routine healthcare, especially if you're sexually active. Think of it as a way to stay informed about your sexual health and address any potential issues early on. Your doctor can help you determine how often you should get tested based on your individual risk factors. And remember, there's no shame in getting tested. It's a sign that you're taking control of your health. While anyone can get an STI, certain behaviors can increase your risk. Having unprotected sex, especially with multiple partners, significantly increases your chances of contracting an STI. It's like playing Russian roulette with your health. You're essentially rolling the dice every time you engage in unprotected sex. If you have a history of STIs, it's important to be extra cautious, as having one STI can increase your susceptibility to others. Remember, knowledge is power. By understanding the risk factors, you can make informed decisions about your sexual health. Thanks for watching. Remember, educating yourself and taking preventive measures are key to maintaining your sexual health. Knowing the facts about STIs, practicing safe sex, and getting tested regularly are the best ways to protect yourself and your partners. If you have any concerns about STIs or your sexual health, don't hesitate to consult with a healthcare provider. They can provide accurate information, confidential testing, and appropriate treatment if needed.